at this point, I'd like to move on to the substantial business of the evening and welcome Dr. Mary Walker, who's a philosopher currently at La Trobe University. Her research covers many areas: bioethics, philosophy of medicine, and narrative and personal identity. So it was quite difficult when she and I were having a discussion about what would be a topic that we could have for this evening's talk. We decided ultimately on an ethical examination of our drug policy proposals. Do they pass the test of proportionality? We know that drug policies embody moral judgments and that many of these can bear careful interrogation. You know, the drug situation, the drug proposals that we operate within are vexed and confused in many instances, I think. And so I'm looking forward to Mary helping us drill down into this topic and get a clearer sense of how we as humanists can understand the complexities of it and come to perhaps a more enlightened position that we can then advocate for more confidently. So last year, I might remind people that we had Judy Ryan come and speak to us. She is a fearless advocate for drug reform, which just grew out of the fact that she lives in Richmond and was confronted by the fact that people were dying in the gutter, and she was constantly stepping over syringes and very much she became a leading advocate for the supervised injecting room that's attached to the North Richmond Community Health Centre. And on the basis of knowing about her work, we were also hoping, as humanists, that the Victorian government might see fit to have further self-injecting rooms elsewhere in the city. Now, they've decided on different policies. That has been shelved for the moment, and they've decided on different policies. So there are interesting practical issues about this, and I think the fact that it's so difficult to move forward in a practical sense relates to what we need to talk about tonight, and that is what lies underneath the attitudes to drug policies. And, you know, some of them are examined and some of them are implicit. So, Mary, I have high hopes that you will throw some light on this and guide us in our discussion this evening. So please welcome Mary for this evening discussion.
With slides and so on. So the first thing I wanted to do tonight was kind of frame what I'm trying to do. So as Jenny said, I work as a philosopher, mainly doing ethics, bioethics. In the past, I've also worked fairly briefly in drug policy. About 10 years or so ago, was at a drug policy government advisory body for a couple of years as a research person. And this paper, as well as some other work, has kind of come out of trying to think through the different approaches that people are taking. Okay, I'll fill that out as we go along. That might be easiest. So you may know this already, but just as a bit of background, there's three general approaches to drug policy. This is just how it tends to be carved up in policy documents and the literature. So there are supply reduction approaches. So these are usually law enforcement. Attempts to perhaps criminalize sale or criminalize possession. and then use law enforcement to reduce the supply. Can also include things like licensing, say for alcohol. I'm going to mainly focus on illicit drug policy though today. Second, there's demand reduction. So this is treatment programs, but would also include, say, interventions into the social determinants of drug use, which might be things like unemployment or social isolation and many other things. And then thirdly, harm reduction. And these are any policy that seeks to reduce the harms associated with drug use that without necessarily trying to impact on whether the drugs are used or not. So just as this is a very loose and general frame, but people taking a supply reduction approach or proponents of supply reduction, it tends to support a kind of punitive approach and criminalization, while at the harm reduction end, there's a tendency for harm reduction advocates to, as you sounds like we will know, to support decriminalization. Officially in Australia's drug policy, we have all three of these. That's been part of our drug strategy for quite a long time. But in practice, most of the funding goes to supply reduction programs. I think it's about over 97%, the last study that I saw on that. So as an ethics person trying to think this through, the most difficult immediate thing is that drug policy and drug use itself have this long history of being really heavily moralized. And I just did some searches on Google Images to demonstrate that, but you've probably got a good idea of it already just from living in the world. These are mostly historical examples. So we see people who use drugs painted time and time again as dangerous, as immoral, as sources of crime and of danger. As I said, most of these examples are historical, but the one at the right, this top 10 thing I downloaded or copied this afternoon from the website of a group called Drug Free Australia. So that one's a recent one. So there are possible arguments and actual arguments made by some about whether using drugs recreationally itself is ethically wrong or ethically fine. Just by way of some kind of quick examples, one might make a kind of consequentialist argument that drug use is wrong because it might harm you, or it might sort of lead you to harm other people. Say if you're driving while intoxicated or some such. It's also possible to have deontological sorts of arguments that using drugs is wrong. And sometimes in the sort of policy language, it seems like people are saying this sort of thing. I'll say a bit more about what the term means in a moment. But it would be something like the idea that, well, there's just something inherently wrong to the act of using a drug recreationally. Mm-hmm. There's also, of course, many potential arguments against the idea that there's anything wrong with using drugs in an ethical sense. There are various ways to dispute these kinds of arguments, as I'll return to that later on. There's also a number of people who've argued from a kind of liberal political stance that people should be free to decide for themselves whether they're going to use drugs recreationally or not. Okay. But there does seem to be in society, and the point of those pictures on the last slide was to kind of show that there seems to have been for quite a long time this idea that there's something wrong with using drugs and that we have drug policies to respond to that. And it's been argued by this sociologist Troy Duster fairly convincingly in this book from 1970. It's a kind of classic book, that whatever the reasons originally for restricting recreational drug trade and use and sales in different places, that it's kind of created over time a belief, or contributed to the creation of a belief that there's something ethically wrong with just using drugs. Okay, so there's this long history of moralization, and there are even quite a lot of drug policy people researchers that I speak to, so say doing social research or medical research related to drugs, who just don't think we should talk about ethics at all, who think any kind of talk about values or morals is going to be regressive, even if it's kind of well intended, that it's going to lead us down the wrong track of kind of contributing to this unhelpful sort of knee-jerk moralization. So that leaves me with, I guess, the kind of central question I'm trying to think through of, as an ethics person, of course, I believe that it's possible and valuable to think through the ethics of things like drug policy in a rational way. But how can we distinguish that sort of reasoned ethical debate from a kind of unthinking, implicit moralization, as I'm calling it, or a kind of unthinking moral assumptions that actually need rational interrogation. And for the rest of the talk, I'm going to refer to the former as ethical and the latter as moral. Hope that's not too confusing. Most of the time in philosophy, we just use the terms interchangeably, but I think that this, I don't know, often when I talk to non-philosophers, this distinction kind of makes sense to them. Okay, so that's kind of to frame what I'm the problem I'm trying to approach. And what I want to try and do in the paper is to apply a proportionality principle to firstly to assess whether drug policies as a kind of framework for assessing whether particular policies are ethically justifiable. But secondly, as a way of helping us to identify when there are moral assumptions going on that could be affecting policy thinking, perhaps in a way that isn't fully clear. So just a structure for the rest of the talk, I'll say a few things about ethical theories and drug policy, then I'll turn to proportionality, and then I'll apply proportionality to some policies to try and show how it works. So I'm going to focus here on utilitarian and deontological approaches. So as I'm sure most or all of you know already, utilitarianism is the view that right actions are those that have the best possible consequences. They can flesh out what count as the best consequences in different ways, but perhaps the most influential way is to say that we should aim in all of our actions to produce the most overall pleasure and the least overall suffering in the world. So in the literature about this, the academic literature, most people seem to think that if that utilitarianism would support harm reduction approaches. And this is often adopted by researchers who, will go to the empirical literature for evidence that harm reduction approaches often reduce suffering in the form of things like overdoses and deaths and, say, the spread of HIV and so on. However, I think this is problematic, as is the case in just about every sort of large area. It's really hard to know exactly what utilitarianism would really imply in practice. So this is a general problem with utilitarianism, that often the costs and benefits of a particular action, among other problems, might seem incommensurable. Like we can't really weigh them up against each other. So this has been argued in relation to drug policy by Don Weatherburn, who's a criminologist. This is his example. One policy cuts public drug dealing by 20%, but encourages needle sharing and results in innocent teenagers being stopped, searched, and questioned by police. The other policy reduces needle sharing and minimizes the number of innocent teenagers stopped, but as a consequence produces a higher level of drug trafficking and drug-related loitering in and around areas that have methadone clinics. And Weatherburn's point is that they seem to be sort of benefits and costs of each policy, but he's not clear on what weight do we give to these different things. And as I said, this is a general problem for utilitarian. So it's not really clear how it would apply. The other theory I'll speak to is deontology, which again, as many of you I'm sure know, is an ethical theory that says that right actions are those that are motivated in the right way, which involves having what Kant, who's pictured there, calls a good will, a will in conformity with moral law. we're to identify what actions are ethically correct using rational processes, which I won't go into here, but he connects the ethical correctness to respect for humanity, respect for human rationality and dignity and human autonomy. So in the literature, a lot of people seem to take deontology to support the view that I mentioned before, that that drug use is kind of inherently wrong. There do seem to be some potential deontological arguments to that effect. And Kant himself says some things that sound a bit like this in relation to alcohol use. So we might think something like people who use drugs are disrespecting their own rationality because of the way that intoxication can impair rationality temporarily. Or we might think something like someone who does this is using their body in an inappropriate way as a source of pleasure. So there's this idea in some of the literature that a deontologist would support a criminalization approach or a supply reduction approach, because insofar as drug use itself might be wrong, then the policies would be kind of correcting an ethical wrong. So that's been argued by a few people. However, again, as is often the case in applied ethics, the interpretation of deontology here is really questionable, I think. Kant himself says conflicting things about drug use. There are a few places he seems to disapprove, but other times he seems to approve of moderate intoxication for different reasons. And so it's been argued by Sarah Hoffman, who's a Canadian ethicist, that deontologists might well support harm reduction. For example, in her argument, her argument is that harm reduction policies would best respect the dignity and humanity of people who use drugs. So there could be deontological arguments for harm reduction as well. Okay, so my point in bringing that out was just to say that it's not particularly clear exactly where we would get to if we approach ethical assessment of drug policies by kind of applying ethical theories in a top-down way. So what I'm proposing to do here instead is to use an applied ethics approach, and specifically this idea of proportionality. It's a fairly intuitive idea, I think, present in a lot of our ethical thinking. It's been central in recent debates about public health ethics, just to kind of motivate why I'm applying this particular principle. And it's also a recognized principle more generally for assessing any kind of situation where we want to know whether it's ethically acceptable to impose some sorts of harms, some sorts of burdens onto people for some end, in order to obtain some end. And we see this in lots of areas of applied ethics. I've just noted a few: just war theory, arguably the oldest applied ethical tradition, and justification of self-defensive harm as well as punitive harm. Okay, so I've hopefully motivated the idea of applying this principle. I'll now explain what it is. So the principle says that in order for it to be ethical to impose some harms or burdens on some group or some person, those harms have to be proportionate. What does that mean? They have to be proportionate either in comparison to some other harms that are thereby avoided, or they have to be proportionate to the harms or burdens threatened or perpetrated by the person or group who is being harmed. Okay, that's a little convoluted, but I'll go through a few examples. So before I turn to the examples, I just want to note that where I say harms or burdens, this could include things that are part of the utilitarian calculus, so suffering, as well as other costs like physical costs, mental costs, economic costs. But I'm also including things like infringements of rights, infringements of freedoms as possible costs, and we might think of them as a sort of ethical cost of particular actions. Okay, and what I want to propose, drawing on some work by David Rodan and Suzanne Uniacke, is that proportionality judgments require us to draw on deontological ways of thinking and on utilitarian ways of thinking. That proportionality judgments have these two types of ethical thinking embedded in them, and thereby give us a kind of framework that's neutral to each of them. So to show you what I mean by this, so thinking about how could we justify imposing a harm on someone? One way is it is referred to as a lesser evil justification, and this is a utilitarian way of thinking. So we might think, I'm justified in harming another person because that will avert a larger harm. So there will be a lesser evil overall. A second way of justifying imposing harm is via desert or liability. And this is usually seen as a deontological idea, right? So the idea would be, well, I'm justified in harming that person because they deserve that harm. They did something such that they deserve that treatment. Okay, just to explain that a bit further, I'll turn to my examples, and I'm going to use a self-defense example. So let's suppose that person A threatens person B with a knife. Most people have the intuition that B is justified in harming A to prevent being harmed themselves. And this is present in most legal systems, if not all of them. Okay, so we could justify this in two ways. We could say, let's say B prevents being knifed by A by punching A in the face. So we might think that that's justified because there'll be less overall harm at the end of the process. We can assume that punching is kind of less likely to cause less harm overall than knifing someone. So there could be a kind of lesser evil justification. A second way of justifying it might be to say that, well, A is the aggressor here. A is doing something wrong in threatening B. And because they are the aggressor, they're making themselves liable to defensive harm. Their own kind of bad action in threatening to harm B has suspended their usual right against being harmed themselves. So that's the way a liability kind of justification would go. Okay, so Rodin wants to argue that we can see these as separate justifications, but in most cases, both of the justifications will be present, and in fact, they will be affecting each other in the following way. So to see this, I'm just going to change the example slightly. So let's suppose that A threatens to step on B's toe. So A threatens to do a really minor harm to B. And in order to prevent having their toe stepped on, B shoots A in the head. Most of us, I think, and tell me if I'm wrong, but most of us, I think, will have the intuition that that is not a justifiable kind of defensive harm because it's disproportionate, right? It's out of proportion to the threat. So the point of this example is to show that if A threatens B, they might make themselves liable to harm, we might say. They might deserve some kind of self-defensive harm, but they only make themselves liable to harm that is proportionate to the threat, right? So the point is that in making a judgment about desert, about liability, we're already weighing up different harms and different outcomes, right? So the consequentialist thinking is built in to the deontological thinking. Okay, and we can also say the converse. Again, to demonstrate this, I'll change the example. Let's say that A threatens B with a punch and B avoids being punched by A by punching A. And let's further suppose that A and B are kind of roughly equal strength and that each punch is likely to cause about equal harm. So I think, again, tell me if I'm wrong, but most people also have the intuition that even causing the same level of harm would be justifiable. And part of what seems to be going on here may well be that there's something about the situation that makes the harm to A more acceptable than the harm to B, even if they were the same level of harm. And this is because A is the aggressor, right? A has done something wrong, and therefore in some sense, deserve to be harmed or deserve to be harmed enough to avoid harming someone else. And what this seems to show, and I've drawn this from Australian philosopher Suzanne Uniacke's work, is that judgments about what actually counts as the lesser evil seem to take into account not just levels of harm, but also some kind of assessment of the different agents in the situation and what they deserve or don't deserve. So in the first point there, the liability judgment relies upon a judgment about weighing harms. And in the second point there, the judgment about how much the harms weigh relies on a judgment about desert. So they're bound up with each other. I'm running a bit long, so I'll just quickly go through this second example. I just thought it'd be useful to have a kind of public health example. So if we think about a policy that we had in Melbourne for a while, under which people who are not vaccinated against COVID-19 can't enter spaces like shops and restaurants. So that's a public health policy that we had temporarily. So again, we could justify this by the lesser evil justification and say, okay, well, this policy would be justified insofar as this suspension of the usual right of these people would be likely to have consequences outweighing that harm. So we weigh the right suspension against the impacts on overall infection rates, say. We could have a liability justification on the other hand, and say something like, and I remember seeing similar kinds of things in some of the media at the time, something like, perhaps in not getting vaccinated, the person is doing something wrong because they're not, I don't know, contributing to herd immunity or something like that. In which case we could say that what justifies the right suspension is that in some sense they've done something that deserves it. I'm not claiming that's true. It's just meant as an example. Okay, but per Rodin and Uniacke's work, these justifications again may well be intertwined. Part of what makes the infringement of the non-vaccinators' usual right to enter shops and restaurants weigh less than the alternative, maybe in part this judgment of liability or desert, or a judgment that they've done something wrong. And conversely, if we think that in not vaccinating, that people are doing something wrong, perhaps people make themselves liable to some kind of harm in the form of a right suspension, but they don't thereby make themselves liable to any kind of harm, indicating that there's a weighting of consequences going on. So we might think, okay, yes, it's fair to stop them entering these particular shops, but we're not going to send them to jail or something. Okay, so hopefully I've set up the ideas sufficiently. And the last part of the talk, I want to apply them to an example of a supply, a demand, and a harm reduction policy. And just to remind you, the idea here, I'm not going to try and argue for or against particular policies right now. I just want to show that this way of thinking about proportionality and applying it can help us to assess which drug policies are ethically justifiable, but also when there might be moral assumptions going on that could be influencing policy thinking. Okay, so to start with, a supply reduction policy criminalizing drug use and arresting users. So a harsher policy than generally used in Australia at the moment, well, for most drugs, I think. Okay, so we could justify this in a lesser evil way. So we could say something, and people do say things like, if we suspend the usual rights of people who've used drugs in this way, if we have a law that says that, this provides deterrence, and this will lower overall use and associated harms. So we might think, okay, that's a good consequentialist argument for some form of criminalization. Alternatively, we might say this, and as I noted at the start, some people do seem to say something like this. We might say something like, well, using drugs is wrong, and therefore people who use drugs have done something wrong and therefore have made themselves liable to the punishment, to the harm. And noting per Uniacke and Redan, these justifications may be affecting each other. The consequentialist justification might be affected by a judgment that people who use drugs have done something wrong, and this makes their rights weigh less than the harms avoided. Conversely, the liability judgment seems to require a judgment of whether suspending the person's rights is proportionate to their action of using drugs, if that's thought to be wrong. So the question is whether this is proportionate, right? And my idea in bringing out these two sides of the proportionality judgment is that they each push us to note certain things about the ethical decision making, or about what we need to recognize and weigh up in the ethical assessment of such a policy. So it shows us first that the harm of suspending the rights of people who use drugs, as well as the further consequences of that, would need to be less than the harms avoided, which might be higher rates of drug use and other harms. But it also seems to indicate that part of what's doing the justificatory work for any such policy is the idea that using drugs is wrong, and this affects the utilitarian calculus, as well as being a kind of perhaps potentially, well, sometimes directly appealed to as well. So it points to the need to kind of justify this thought that not only would we need to justify the idea that using drugs is wrong, but that it's a serious enough wrong to warrant that kind of right suspension. Okay, the second policy example, providing drug treatment services. So again, we could find a lesser evil justification for adopting this policy. I couldn't really think of any harms from such a policy in terms of rights, assuming that people are taking up treatment voluntarily and that it's you know, some kind of evidence-based treatment and so on. It would have other costs, which would come into a consequentialist approach, which might, well, probably primarily economic costs. Some talk about things like sending the wrong message, if you want to count that as a cost. And they could be weighed against expected benefits, like reducing use and harms to people. So what I'm trying to show is that it forces us to identify what we're counting as a harm and what we're counting as a benefit, but also forcing us to identify when there might be judgments about who deserves what going on here. And this is where the liability justification comes in. So the other kind of side of the proportionality judgment here would be a question about whether people who use drugs are judged to deserve treatment, judged to deserve that that kind of policy. And this might depend on how drug use itself is seen, as well as how addiction is seen, whether it's regarded as a wrong action or as a reflection of a disease, as some hold, or as a choice or as something else. And again, the point is that the assumptions that are made about liability are going to also affect the lesser evil justification and vice versa. Finally, supervised injecting rooms, which Jenny was discussing at the start. So to decide whether, or tell whether these are a proportionate kind of policy, we can investigate the lesser evil justification. Again, there didn't seem to be any harms of this policy in terms of the rights of people who use drugs, I don't think, but there could be economic costs. Some, I believe, still talk about sending the wrong message as a kind of cost of harm reduction policies like this one. And these kinds of costs, or potential costs noted at the end, you know, these were very much a focus of the discussion in the latest, say the Lay report into the second medically supervised injecting centre, that say that the costs were seen to be things like effects on businesses nearby, because of attracting people who use drugs to the area, and reductions in public amenity that people associate with that. And we could then weigh those against expected benefits, which I've just noted a few there. There may be others. Okay. But part of the policy thinking does also, I think, seem to invoke some kind of liability justification. So if drug use itself is judged to be wrong, people might view this kind of policy approach as inappropriate, as undeserved by the people who are choosing to use drugs. And again, this kind of judgment, seems to feed in, I assert, to some kinds of policy thinking. And I guess another part of this, and part of the, what counts as a cost and what counts as a benefit in the lesser evil justification, seems to also be this idea that maybe people in general have some kind of right to good public amenity, or have some kind of right not to be affected by other people using drugs, such that the effects on public amenity are undeserved by the kind of general community. Okay, I haven't gone too far over time. Hopefully, just to finish up some conclusions. So I hope to have demonstrated that this application of proportionality, and in particular recognizing the different kinds of ethical justification going on, can be useful in ethically assessing actual and proposed policies. And that their application is also useful in forcing us to clarify what are the moral assumptions going on about desert, and about how much different costs and benefits matter, and how they can be weighed against each other. This doesn't resolve how to judge anything about what counts as a lesser harm, or whether using drugs is ethically dubious or completely fine. The idea is just here to provide a kind of framework for assessment, and a framework that forces us to make all of those judgments explicit, so that we can then hopefully properly interrogate them. And I'm hoping also that by drawing out the kind of the consequentialist and the deontological side of the reasoning, that this makes the framework a bit more neutral to particular ethical theories or political approaches as well. Okay, I'll stop there. Thank you.